Good afternoon, everyone, and welcome to today's webinar on fundamentals of laser therapy for veterinarians. We'll be starting in just a few minutes. I just want to make sure that everyone can hear my voice because I did have a comment that no one could hear anything, but we haven't actually officially started yet. So I did make an announcement a few minutes ago. So again, if you're listening in and you can hear my voice, just type that in so I know that everyone can hear. And we'll be starting in just a few minutes. Thank you.
So how many do we have?
16 are in right now.
Not horrible.
Yeah, hopefully. I mean, we should get 30 to 40% tuning in, so we still have a bit of wait.
What?
Pardon me?
Was Dr. Mester actually trying to create cancer?
No, he was trying to. No, he wasn't trying to create it. He was trying to. So he read this paper by McGruff, and McGruff had embedded cancer cells in the cheeks pouches of hamsters, and then a tumor grew and then used laser to eradicate it.
Right.
So he wanted to replicate that. So he was inserting cancer cells in the bellies of rats to grow into tumor, and then he wanted to use the laser to treat them and to get rid of them before he started to work on humans, right?
Yeah.
And then, of course, it was calibrated much lower than the ones McGruff used. And instead of having any real effect on the cancer, it was the hair thing.
Right.
Yeah. Got it?
Yeah.
Okay. All right, so everyone can hear us. So I'm going to just put it like that. What's your Master's of Science in?
Human Health and Nutritional Sciences, but it's like it's biomechanics, human physiology.
Yeah. Okay. I'll just say Master of Science just because it's too much for me to remember now.
Exactly. And you'll jump in when I'm talking about the different classes if you need.
Yeah. I'll chime in whenever, and feel free to chime in as well on me. Right. I mean, so we're at 22, so that's good.
Okay.
One more minute. I booked my flight to Lima, Peru, going to Machu Picchu in June for almost 2 weeks.
What's the weather like then? Beautiful.
So it's because once you go up the elevation, it gets pretty cold at night, kind of thing. But it would be nice. It would be in Lima. It would be hot, probably high 20s, low 30s, and up when you get into mountains and everything. The days will probably be high teens, low 20s, depending on the sun, that kind of thing. But at night, it will chill right down to like 5 or 6 degrees or something like that. So we're doing a 4-day hike up to the Machu Picchu.
I've had a few friends that have gone to Machu Picchu in the past couple of years, and it was stunning.
Yeah. Did they really enjoy themselves?
Yeah. Are you Airbnb-ing or are you?
Yeah, in Lima and some other places, but not the hike.
Okay.
All right, let's get the ball rolling. Okay, welcome back, and thank you everyone for joining us for our webinar today on the fundamentals of laser therapy for veterinarians. I'm joined by Rhianna Malcolm.
Hi, everybody.
And Rhianna is a Master of Science. She's been working with Meditech here for quite some time. She's the account executive in charge of veterinary applications as well as human applications for our devices, BioFlex Laser Therapy. A bit of housekeeping before we start. I did get feedback from everyone that they can hear my voice, so that is good. This webinar will be recorded, and if you miss it or you have to chime out early, you'll be sent an email with a link to watch it again. It will also be on our support page for BioFlex users to listen in at any given time. If you have questions, and we do encourage questions, please write them in as we go along, and then I'll get to those questions at the very end of the webinar. Okay, let's get started.
Okay, so before we jump in and start discussing veterinary applications for laser therapy, I wanted to give you guys a brief summary of some of the historical advances that have led us to what we know and what we practice today in clinic. So a lot of this began with Andre Mester once the first working laser was created in the early 1960s. And Dr. Mester was working out of Semmelweis Hospital in Hungary, and he was attempting to eliminate tumors with a high-powered ruby laser. Little did he know, his laser was actually miscalibrated, and he was operating at a lower power than he originally thought. But lo and behold, instead of burning or irradiating cancer cells, he actually found that the ruby red laser had a stimulating effect on the skin of rats. And this stimulating effect was demonstrated in one of Dr. Mester's first papers, which was published in 1968. And as you can see, Dr. Mester shaved the bellies of the rats and directly irradiated them with red light. So if you turn your attention to the picture on the right-hand side, this demonstrates the stimulatory effects of the lower-powered laser on hair regrowth. It's also important to note before we move forward that the picture on the left is actually not a control rat. So once Dr. Mester noticed his miscalibration, he wanted to increase the power of his laser to see if this increased power had a greater effect. And as you can see from the left-hand side, it actually did not, and it had little to no stimulatory effect on hair regrowth. And from this study, Dr. Mester demonstrated the importance of dosaging and power.
Right. So really what we now know is that if you overdose, have too much light, it actually is counterproductive and you don't get the stimulatory effect. So this is very important, and we'll touch on this as we go forward.
And the next point I want to make is Dr. Mester's demonstration of red light's effect on wound healing. So very similar experimental paradigm. However, he cut skin flaps into the bellies of these rats. The left-hand side is going to be your control rat. The right-hand side is going to be your experimental rat. And Dr. Mester directly irradiated one wound, so the left-hand wound, directly irradiated that with red light. And as you can see, the effects of the red laser has drastically increased and improved the healing process. However, another important thing that we like to discuss is going to be the indirect effects that the red light has as well. So that wound on the right-hand side was not directly irradiated with red light. However, that healing process has been improved once again. So Dr. Mester was the first researcher to show that red light not only has a direct effect on the tissue that you treat, however, it also has indirect systemic effects as the light is absorbed by the blood and circulated throughout surrounding tissues.
Right, and this is really important because when you're trying to get this indirect or systemic effect, you need to treat the blood essentially in the animal that you're treating, and this takes a little bit of time, a little bit more time than treating just direct tissues.
Yeah. And in research, as well as in the clinical world, you might come across a few different names for photobiomodulation. Photobiomodulation is what's accepted in the research today. However, what you also might hear, low-level laser therapy, low-level light therapy. So they're all kind of interchangeable. However, photobiomodulation is what's clinically accepted in the research. And LLLT, or photobiomodulation, at its most basic level, uses superluminous and laser diodes to effectively heal pathologies by covering both a large surface area as well as targeted laser points. And this language is understood by the cells when light is used in both the visible and infrared spectrum. LLLT is a non-thermal process, which means it's less than 500 milliwatts, which involves endogenous chromophores, which elicit photophysical and photochemical events.
Right, and just to point out that when we talk about under 500 milliwatts, that is per diode, not the total amount of energy. So you do have to be aware that this represents the thermal threshold of a diode. If it's a greater than 500 milliwatts, you will actually get heat being produced.
And this LLLT process promotes beneficial therapeutic outcomes that can include alleviation of pain, inflammation, immunomodulation, and the promotion of wound healing and tissue regeneration.
Right, so I'll delve a little bit into the mechanism of action. So essentially, we're looking at tissue absorbing light, and this light is actually accepted by what's referred to as chromophores or photoacceptors. So the photons of light are absorbed, and it causes a actual structural change in the protein. This light energy can also free up binding sites, which accelerate cellular energy metabolism, and I'll talk about this shortly. And this will lead to many secondary and tertiary effects within the cell itself. clinically, we're interested in what happens. And so you can have a reduction of pain, which is very important for your animal when you're treating subjective and objective changes, as well as key being the healing process is accelerated. So this is an overview of what's happening. When you take light of a certain wavelength, and traditionally those wavelengths are anywhere between 600 to 900 nanometers, and I'll again discuss this briefly shortly. This light is absorbed by photoacceptors, some of the main ones being cytochrome C oxidase and calcium ion channels. And this will lead to, as I mentioned, to secondary and tertiary reactions within the cell that helps with wound healing and tissue repair and pain relief, and some of these other positive subjective and objective effects. So what is a photoacceptor? Well, probably in the plant world, you're familiar with those. For example, in plants, chlorophyll is the key photoacceptor for light that causes photosynthesis. In humans, we have many different types of photoacceptors. Rhodopsin is in the retina, hemoglobin in blood, myoglobin in muscle, and all cells have different types of cytochrome. It happens to be that cytochrome within the mitochondria is a chief photoacceptor for the mechanism of action of photobiomodulation. This is a graph showing the absorption spectrum, the active absorption spectrum of cytochrome C oxidase. And you can see to the far left, and as we go increasing wavelengths to the right, from 500 to 600, it's well absorbed, and then it starts to decline down around just over 700 with another peak getting towards 800, and then a decline again. So these are the wavelengths that this enzyme is stimulated by. However, we also know that blood, and hemoglobin especially, is also highly absorbed anywhere from 500 to roughly 600, where it drops off dramatically. And on the far right, getting towards infrared, near-infrared wavelengths, water also is highly absorbed, starting around 900 and pushing past 1,000 nanometers. So you can see that if we want to stimulate this enzyme, if we were to use wavelengths in the range that is absorbed by blood or water, not much of that light would actually be absorbed by the photoacceptor cytochrome C oxidase. So there's an actual window, treatment window of wavelengths that seem to be more effective. Traditionally, red and infrared and near-infrared are the wavelengths that tend to be used in photobiomodulation. This is just a little graph showing you that treatment window of wavelengths. And as I just mentioned earlier, the wavelengths are being absorbed by hemoglobin and water. So really, if you're going to use photobiomodulation, you want to make sure the wavelengths that you're using are correct for the most direct effect on the main photoacceptor. So the main mechanism of action revolves around the mitochondria of the cells. Mitochondria, as everyone's aware, are small organelles inside the cells that produce ATP. So if you look at the cell wall, the outer cell wall of a mitochondria, some of the enzymes that we're interested in are the ones that are involved with the electron transport chain, or the ETC. And the second last enzyme is cytochrome C oxidase that I've mentioned earlier, and ATP synthase being the terminal enzyme. So what normally happens is a proton gradient pump allows electrons to be transported down the chain of proteins with the eventual formation of ATP from ADP. So this energy is being converted and making adenosine triphosphate, which the cell can now utilize for metabolism. In a state of inflammation, what happens in the cells is a buildup of nitric oxide. This is a byproduct of inflammation, and nitric oxide has a much higher preferential binding to copper and iron subunits within the terminal enzyme, cytochrome C oxidase, and it blocks oxygen from binding. So you can imagine if you block oxygen, this whole process starts to slow down, and the ability for the cell to produce ATP is markedly reduced. Essentially, that means that the cells and the tissues will start to die or will start to undergo poor metabolism. So this would be a slower healing process if prolonged. What laser therapy does is really a photochemical reaction. So certain wavelengths, as I mentioned earlier, actually interact and break the hydrogen bond between nitric oxide and copper and iron. By doing this, it allows oxygen to bind back on and facilitating the proton gradient pump, and thereby allowing an increase in ATP. So you're normalizing the production of ATP, and this will cause a whole series of cascade of chemical reactions within the cell to help it normalize metabolism and repair itself and eventually undergo mitosis and regeneration. So this is a little schematic diagram showing just what I've described. On the far left is the cytochrome C oxidase. You can see heme, which is iron and copper subunits, and normally oxygen binding to these subunits is blocked if there's high levels of nitric oxide secondary to inflammation and tissue damage or disease processes. And then you can see on the far right, the red or near-infrared light, if absorbed, will actually break the hydrogen bond, allowing oxygen to bind back onto copper and iron, thereby increasing ATP and respiration rate of that cell and allowing for tissue repair. So really there's primary, secondary, and tertiary effects, and eventually leads to clinical benefits. As I mentioned, the light first must be absorbed, and then this causes a whole series of other reactions to occur. And over time, then you can start to get wound and tissue healing, which I'm going to focus on in today's webinar, along with acceleration of the inflammatory process and modulation of pain. It's important to note that there's both direct and indirect effects of photobiomodulation. Direct effects are when you take a cell that's been injured, so this could be due to a wound or post-surgery injury in an animal, and then there's a whole series of processes occurring due to inflammation, but these have damaged cells. And through that whole process I mentioned earlier, the mitochondria are not functioning to their high degree to restore normal metabolism. If you irradiate that cell with near infrared, which is what NIR is, or red light, then you can actually change this process by the mechanism I just previously described. So that's a direct effect. You take the light, you irradiate the cells and tissues directly, and you will have a positive outcome if the dosage of light is adequate. This is important to understand that while light can have this effect, if the damage lies deep in the animal, then it's very challenging to get the light directly to the tissues because light only penetrates to certain depths in the tissues. One of the positive effects also of light therapy is an indirect or systemic effect that Rihanna mentioned earlier. So if you're treating around a tissue damage in the animal, you can stimulate the blood. You can actually do it via the bone marrow, but more easily you can do it on the subcutaneous tissue. This blood is stimulated, especially the stem cells and white blood cells, and they're stimulated, and the effects of that is they produce anti-inflammatory mediators that are secreted in the blood and carried in the bloodstream in and around the area that's been damaged or injured or diseased or post-surgical, and the effects will then be occur on that cell. So it's not a direct irradiation, it's an indirect effect mediated by immune cells. So this is referred to as immunomodulation. And it does take a little bit more time, and we do specialize this particular type of effect along with the direct effect with our BioFlex equipment. Physiologically, photobiomodulation is known to increase blood supply via angiogenesis and neovascularization by stimulating endothelial cells that form new capillaries and new branches of capillaries in the area that you're treating. Very important for wound repair and recovery. Also, it's known to promote collagen production for repair of tissues, along with direct effects on muscle regeneration and muscle atrophy. I'm going to talk more about the muscle effects in the next webinar, along with inflammatory and nerve regeneration, cartilage production, and bone formation. So any cell type, light can interact and have a positive effect on its metabolism. Another important aspect to understand about photobiomodulation revolves around what's referred to as the Arndt-Schultz law or dosage dependency. So in this diagram on the far left you can see physiological activity and then the strength of the stimulus. If between A and B, the stimulus, in this case light, is too weak, you won't really see much of physiological activity. So you won't really see any net benefit to the animal that you're treating. However, as the stimulus is increased and the dosage is high enough, then you will start to see a positive physiological activity, in which case you're looking for symptomatic relief, accelerating of wounds, and so forth. But eventually you get to point C where you have optimal amount of light. And as you go past that point and have excessive amounts of light, you can see that the physiological activity actually starts to diminish. And eventually, if you get to a point where there's too much light, especially if it causes a heat threshold and you're thermally activating the cells, then you can become inhibitory. So it's important to understand that you need to get correct dosaging of light to have a positive effect. Too little, no effect; too much, not as good of an effect; and way too much will lead to a bioinhibition. This is well understood aspect of photobiomodulation. So depth of penetration is really important to understand. If your tissue that you're trying to treat lies very deep, then you need to understand when you apply the light to the tissue, it's going to be absorbed in a three-dimensional volume that makes its way down into the tissues up to a certain depth. Of course, you can imagine that most of the light will be absorbed as it's penetrating down into the tissues, and very little light will reach the maximum depth. This depth for red light is roughly a few millimeters to maybe a centimeter or so. And for infrared light, because it's not absorbed very well by hemoglobin, will go deeper, anywhere from maybe 1-2 centimeters to possibly 3, 4, 5, or 6 centimeters. The determining factor for that is the wavelength, as well as the strength of the energy at the surface of the skin, and of course also the the density of the tissue that you're treating. So bone, ligament, tendons, muscle, they will all absorb light at different rates, and therefore that will determine the depth that light can penetrate. There's two ways of using low-level laser therapy. One is through contact, where you actually touch the skin directly. This allows light to penetrate into the tissue deeper, or non-contact, where you hold the light away from the skin, and a lot of that light will be reflected off, and therefore you minimize the amount of light that will be absorbed. Almost all modes of treatment will use contact technique. The only time you're not going to use contact technique is if you're over a wound where you can't directly touch that wound itself. Oftentimes we'll put a barrier, plastic wrap, between the light source and the actual open wound, so we'll get pretty close to the tissue. So most of the time we're trying to get light deeper into the tissues to have a dramatic effect as much as we can produce. So red light usually is around 660 nanometers, anywhere from 630 to 680 is pretty good. This energy, as I mentioned, is absorbed a little bit more by hemoglobin, and therefore it does not penetrate as deep. Whereas infrared light, again, the best wavelengths are anywhere from 780 to 900, with peaks around 830 to 840 nanometers. And this light can go a little bit deeper, as I mentioned, and allows you to treat even deeper conditions. So I have Brianna talk a bit about the differences between Class 4 laser therapy and Class 3.
So one of the main talking points that I hear from veterinarians really revolves around the parameter power. And power is going to be directly related to class of laser that you have. Class 4 lasers operate in the greater than 500 milliwatt spectrum, so 500 milliwatts all the way up to 10, 15 or more watts. And the Class 3 lasers, like we discussed earlier, are going to be less than 500 milliwatts per diode. And both classes of lasers are used in veterinary medicine today. However, I always think it's important to note some of the limitations associated with using high-power Class 4 lasers. First thing that I like to note, there's not many peer-reviewed scientific studies involving Class 4 lasers. So not a lot of researching bodies are looking at them, and the studies are quite limited, so we don't know enough about them to really conclude everything that's going on. And like we discussed before, Class 4 lasers generate quite a bit of heat, so the laser must be held off of the skin, which can cause some reflection of light photons, so decreases the penetration. and it must be moved around quite frequently in order to avoid burning tissue. So these methods of treatment limits accuracy, and it's not necessarily a very efficient way to deliver the appropriate dosage to tissues. And another important point to make that Dave already discussed, many of these devices use wavelengths that are absorbed by water, so they are typically in the 904 nanometer spectrum or above. So this limits the penetration, heats tissue, and it's not necessarily providing light photons down to the tissues that you're trying to treat. Next is going to be class 3B lasers. So that's where we operate. We're operating in the less than 500 milliwatt spectrum. And class 3B is going to be the most peer-reviewed and research class for therapeutic lasers. So there is plentiful amounts of research supporting the therapeutic benefits of these lower power lasers. Class 3B lasers produce minimal heat, so which allows us, like Dave said, to use the contact method, and we can apply both our superluminous diodes and our laser diodes directly to the skin and to tissues in order to increase accuracy and dosage delivery. This low power laser, so class 3B, produces cellular, not thermal effects within the cell, which promotes the photobiomodulation process.
Right, and it's really interesting to note that the first actual paper on photobiomodulation back by Mester was on an animal. So it actually has been used in the veterinarian world for really since the very beginning of its discovery. A lot in the equine world for horses, but it's certainly in rehabilitation, post-surgical. And there are quite a few not randomized control trials, but peer-reviewed research papers on low-level laser therapy in the veterinarian world as well.
Next, we want to discuss our indications for laser therapy within the veterinary world. We use 3 treatment platforms here for our veterinarians, and they really revolve around rehabilitation and post-surgical, along with performance and prevention. And like Dave just discussed, our largest treatment platform in clinic is going to be around our rehabilitation and post-surgical healing. That is the most popular, and it has been the most researched. And we use that to accelerate tissue repair, reduce pain, inflammation, reduction of fibrous tissue formation, amongst other things. And this is really what we're going to focus on today in some of our case studies. We're going to look at some wound healing and post-surgical applications. However, we also do have performance and prevention platforms as well. The research shows that in regards to performance, laser therapy can help increase agility. It aids in faster recovery from both exercise as well as injuries, reduction of muscle fatigue, and again, this all relates to overall improved performance. And then when we get to the prevention side of things, we fall back on the basic photobiomodulation process where it increases circulation, improves joint health, reduces inflammation, promotes optimal health overall, and really just make sure that your animals that you're treating, whether that be a horse, a cat, or a dog, is functioning optimally and hopefully going to avoid the need for rehabilitation and treatment of injuries down the road. So specifically for wound healing, there are quite a few different categories of wounds that we can treat. These include surgical, incisional wounds, lacerations, degloving injuries, burns, avulsed wounds, as well as puncture wounds. So we have applications for all of these, and laser therapy can definitely help accelerate the healing process for all of these wound categories.
Right, so just to review on the wound healing stages that everyone's familiar with. Initially, within a few minutes, you have hemostasis, so you have vasoconstriction and coagulation, followed by vasodilation. And then within an hour, you have the inflammatory phase that sets in via the neutrophils. These are polymorphonuclear cells that predominate, oftentimes excessively, that cause the inflammatory process. Then over a period of hours to days, you start to get proliferation, eventual migration of macrophages into the area that sort of get rid of the neutrophils and help promote and secrete other cytokines that help promote angiogenesis and contraction of the area, and eventual maturation remodeling that occurs over a period of weeks and months and sometimes even years. So this is well understood as far as what's happening during the wound healing process. And what's really interesting to note is that when you compare that to the effects of photobiomodulation, by the way, this is taken from a paper at the bottom, reference-wise, you can look up if you wish. We know that actually photobiomodulation works on all these different phases, everything from the inflammation phase through neutrophils, through proliferation, epithelialization, and fibroblast proliferation. It helps with granulation tissue formation. I did mention earlier about collagen production and wound contraction, along with angiogenesis. So it works by remodeling and promoting all these different positive effects. And so basically it's accelerating this wound, the wound healing stages to a much shorter time frame. So if you add light therapy to the wound, you'll actually see that wound heal much faster than if you let the animal heal on its own. So if that's the case, then we need to understand its applications. So a summary of all these different effects you can read in front of you, everything from increasing epithelialization to the cellular effects on ATP, to matrix synthesis and decreasing inflammation and promoting wound closure and so forth. Before we finish, and we are getting close to time now, Chip Godine, or Richard Godine, is a veterinarian, past president of NALT, which is a North American Association for Photobiomodulation, previously laser therapy. And Chip has worked with us in the past. In fact, he helped develop our veterinarian protocols in our manual. And he's presented at quite a few of our seminars on veterinary applications. So these are courtesy of Chip. The first one is a wound you can see here that was initially treated with antibiotics, and it was not healing. So Chip took the cat off the antibiotics. This is an array. It's sort of as an older style array, but we have similar arrays now where you can actually apply directly over that wound. Oftentimes it would be a transparent wrap, or you would just, of course, clean that area. The advantage here is that you're treating a wide area of the skin, both around the wound and directly over the area. So this is going to help with the systemic effect, or an immunomodulating effect, to help reduce the inflammation and stimulate the wound healing process. This was a period over, I think, 20 treatments in total to get complete wound closure. And the wound had been open for about 4 weeks at that point. So really good results. Another case where there was an injury to the paw of the dog. And in this case, it was actually 2 days of treatment using just a red and infrared array. And Chip had noted that the swelling and the edema had almost been eliminated, and the wound had almost healed after about 2 sessions. So the next webinar is, just because we are cutting it short for time right now, we'll talk a bit more about rehabilitation, especially on the effects on pain and how you can help modulate pain in your patient, along with the effects on performance, on skeletal muscle endurance and strength, fatigue, and training recovery, if you have animals in that type of field, and also preventative use, really revolving around degenerative diseases like osteoarthritis and other arthritides, to help your animal reduce its pain and it's actually slow the progression down of these types of degenerative problems. Thank you all for listening. We really do appreciate you tuning in and taking the time. We will be doing another webinar again in a month's time on those different subjects, and I will take some questions now. So let me pull those up and see if there are some questions here. Okay, so actually I don't see many questions, which is fine. But if you do have any that you'd like to send us, or want to ask Rihanna with respect to the equipment, that type of thing, our emails are here. It's both david@bioflexlaser.com and Rihanna at bioflexlaser.com. Thanks everyone for joining us, and hopefully you'll tune in next week or next month. Thanks very much. Bye now.